Sauna Jai Shri Krishna, Jai Jinendra, Jai Swami Narayan, Sai Ram, and good evening to everyone and welcome to you all. On behalf of GAA London, I would like to warmly welcome you all to today's community health webinar on back pain. Thank you for taking the time to join us this evening. Back pain is one of the most common health issues affecting people of all ages, especially with modern lifestyles involving long hours of sitting, computer work, and reduced physical activity. So today's sessions will help us better understand the cause of back pain and more importantly, how we can prevent and manage it in our daily lives. We are pleased to have with us Dr. Xander, again, a qualified chiropractor who had been practicing since 2008. Dr. Xander had extensive experience in diagnosing and treating spinal and musculoskeletal conditions and helping patients improve their postures and overall spinal health. So during today's session, Dr. Xander will cover the anatomy of the spine, lower back, pelvis, and hips. Why back pain has become so common? Think about it. The most frequent cause of back pain. Practical tips of maintaining a healthy back, including desk setup, sleeping positions, and lifting techniques. So, at the end of the presentations, we will have questions and answers sessions, so please feel free to note down your questions. We kindly request everyone to keep their microphones muted during the presentations to avoid the background noise. And you may type your questions in the chat on the side box, and we will take them during the Q&A session. And I would also like to, encourage few of you showing your faces, so Dr. Xander don't feel that he's speaking to a black screen. Sorry. Thank you again for joining us this evening. Now it gives me a great pleasure to invite Dr. Xander to begin today's presentation. Over to you, Dr. Xander. Welcome back.
Well, thank you for having me. Thank you for the introduction. And lovely seeing everyone again. So as we've said before, today is to take away some practical advice in terms of how to look after your spine a bit better. And if, yes, there are any questions at the end, I will do my best to try and answer them as much as I can. As a chiropractor, our main focus is on spinal health and well-being and how your spine impacts the function of your nervous system. So I'll explain a little bit about that. And yes, as we said, some tips to help yourself out a little bit more, because at the end of the day, most people would suffer from some sort of back problems in their lifetime because back pain has the highest prevalence of all musculoskeletal conditions. So what musculoskeletal conditions are is basically made up, think of it as any type of mechanical pains. So joint pains, hip pain, shoulder pains. It has it's the most prevalent of all types of back pains. Now, for reference, about 85% of people with chronic or long-term musculoskeletal pain or back pain are deficient in vitamin D. So there is a very high link between being low or deficient in vitamin D and sufferings from back pain. Now, unfortunately, in the UK, we don't have enough sunlight from obviously from certain times of the year. So it's very important to supplement with a very good high dose of vitamin D from around September to about springtime. So for reference, 10,000 units of vitamin D is equivalent to being in the sun for about 20 to 30 minutes. So unless you're able to travel to somewhere abroad on a regular basis, it is advisable to take a very good vitamin D uh, from around autumn time to about springtime. So just some statistics in terms of back pain. Like I said, it is the most common uh, form of disability in the world, according to the World Health Organization. It's the highest in terms of who suffers with back pain the most, 50 to 55 years old. However, uh, anyone can suffer from back pain. And as we, as was mentioned in the introduction, with the world being so stressful and busy, and especially with sedentary work, sedentary is basically just desk-based. The rates are significantly increasing from my experience. Back pain is not uh, age-related. So I personally don't believe in the term old age or wear and tear. Uh, as you can see, this is quite a big study that was published in 2015. So they put people in an MRI scanner, but the most important thing was these people did not have any pain. Now, the important thing is that you can see that 37% of 20-year-olds who had no pain had disc degeneration in their spine. And we'll talk a bit later about how the discs in the spine receive their nutrients and how they degenerate. But the important thing is, like I said, it is not age related. When we get chronic pain, which obviously back pain is the most prevalent, there is a increased risk of developing dementia. Reason why is the brain is constantly bombarded by pain signals over and over and over again. So it is very important to also make sure that you proactively look after your health, but also proactively look after your spine. So we'll talk about how we can do that. Now, the standard usually way to go about treating pain is either one of two ways, either medication or surgery. Now, unless it's a medical emergency for back pain, there is no evidence that shows back surgery does anything. Medical emergency is a condition called cauda equina syndrome, which is basically there's so much compression on the nerves in the lower back where the person would lose bowel and bladder function and they will get numbness down the back of the legs. So that, yes, is a medical emergency and that would require urgent surgical decompressive surgery. If you do, sorry, five things. These are five things that I recommend for all my patients to do, not just to help manage their pain, but just to improve your general health and well-being. So we have feeding your body the right nutrients. If we talk about diet and we talk about muscle, obviously your muscles are the framework around your spine. If your framework is weak, then obviously that means that the spine is not going to be able to function optimally. And your spine protects your nervous system, which is your spinal cord and the nerve roots which exit the spine, controlling every function and every cell tissue in your body. So if you're not eating enough protein, you can't grow healthy muscle. If you don't grow healthy muscle, then again, that is going to impact how well your spine is able to move. So make sure that you're eating enough protein. Okay. Now, for those of you who are potentially vegetarian, obviously that's something that you have to consider as well. So sources of protein for vegetarian diet, nuts and seeds, chickpeas, hummus, etc. Do regular exercise. Okay. When you do regular exercise, you are loading and strengthening up your bones. You're strengthening up your muscles, and obviously regular things like yoga or Pilates is very important as well to keep your spine flexible and also to keep your muscles strong. Making sure you make time for yourself to either meditate or relax or do things that you do to basically take a step away from busy life. So whether that be going for a walk, writing in a journal, having a bit of a nap, speaking with friends, family, etc., just to take your mind off, unfortunately, the stresses and strains that day-to-day life brings to us. Making sure you're getting enough rest, because obviously your body needs to be able to heal. If you're not sleeping properly, then obviously your body doesn't have the time or the capacity to be able to heal itself. Especially the REM sleep, which is the deep sleep, that's the most important phase of the sleep. And then me as a chiropractor to keep the spine healthy, to keeping it well, which then complements obviously all the other factors as well. So as I mentioned, your nervous system on the right is made up of your brain, the spinal cord, which sits inside the spine, and then the nerve roots, which exit each of these levels in the spine. So the nerves in the neck, they control your arms, your diaphragm, your shoulders, your ears, eyes, face, etc. So last week we talked about how compression and irritation on the nerves in the neck can cause things like headaches and migraines. The nerves in your middle back, obviously they feed into controlling all of the organs. And then the nerves in the lower back, they control your bowel, your bladder, your reproductive organs, and then the legs and the feet. So some presentations of back pain could be, for example, if someone is coming in with pain in the flanks, which is basically pain in the side, and that's referring down into the hip or groin area. The first thing that I would think about would be a UTI, or a urinary tract infection. Okay. So sometimes back pain can be coming from organs, can be coming from the liver, obviously can be from the hips, etc. as well. But back pain has a lot of different components. It's not just mechanical, it can be from a lot of other factors, which we'll talk about in a second. So as I mentioned, your nervous system controls everything in the body. So back pain can come from any of these structures because the way your body works, your brain sends information down the spinal cord through the nerves to every part of the body. That information is then sent back into the spinal cord, back to the brain, and is working like a safety pin, like a loop, 24/7 all the time. When we create stress or interference on the spine, the information between the brain and the body is disrupted. So the way you can think of it is basically rather than having the lights on full brightness, it's turning the lights on a dimmer switch. So we're still getting information to the brain and to the body, but the information is not 100%. And how important spinal movement is to your brain function, well, it's quite important. So as you can see, 90% of your brain's nutrition and stimulation comes from spinal movement. Hence why it's so important to maintain a healthy spine, again, regardless of having pain. Pain is like a fire alarm. Whenever we get any type of pain, that is your brain's interpretation of something going wrong. So, potential causes of back pain. If we look at your lower back is made up of 5 joints, and they're listed as L. L for lumbar or lower back. T is your thoracic or your middle back, and then C is cervical for the neck. So for now, we're just talking about your low back. So we'll have L1, L2, L3, L4, L5. L5 is the last vertebra in the back. Okay. Between each of your vertebra is your disc. So the disc is 80% water. When you get dehydrated chronically, your discs will start to degenerate because they need water to stay healthy. They need a couple of other things as well, which I'll talk about in a second. But staying healthy in terms of disc wise is very important to stay hydrated. So how much water do you need? Well, ideally about 2.5 liters of water every day. Ideally, you should have a little bit more, but general guidelines is 2.5 liters of water. Now, tea and coffee, they don't count. They act as a diuretic. A diuretic is a stimulant, and it also dehydrates you. So for every cup of tea or coffee you drink, you need to drink 2 cups of water to replace the fluid that you're going to lose as a result of drinking tea or coffee. So just bear that in mind. If you want to drink tea or coffee, fine, but still make sure you replace the fluid that you're going to be losing as a result of that. So we have the discs. Inside the spine, like I said, we have the spinal cord, and then we have the nerve roots which exit. Then we have down here, just at the back, we can't see it, but that's where the coccyx would be, or the tailbone. These two joints in here, they are called your sacroiliac joints. So those sacroiliac joints, they take 50% of your upper body weight. This in here, this is called your pubic symphysis. So ladies, during pregnancy, that would widen, and then obviously the baby would then come out. That could be a source of pain sometimes as well. The sacroiliac joints, they can be a source of pain. Your pelvis is designed to move like that, forward and back. As a chiropractor, what we assess for is any imbalance in the pelvis. So your pelvis can tilt. If this is a left, this will be your right side. Excuse me. So what can happen is the pelvis can either tilt on the left side backwards and then forward on the right. So as you're walking, that imbalance over time, it starts putting shear stress and pressure on the sacroiliac joints, which is then going to affect ligaments, the hip joint, and all the surrounding muscles, and also the nerves coming through and around that area also going to get irritated. Then another way it can misalign is it can tilt inwards and then outwards. So it'll be an internal rotation or external rotation, or a combination of all of that. How that happens? Well, a lot of reasons. If you're sitting cross-legged, so ladies especially, I'm talking with you, if you do have a preference to sit with one leg over the other, obviously guys as well, make sure you cross your legs. Because if you keep putting one leg over the other, you're creating a habit and a pattern. So your body starts getting used to the right side getting dropped down and then flaring out. And if you keep doing that over and over again, obviously your brain starts interpreting that as, okay, well, this is nice. Let's kind of gradually rotate that way. So make sure that you swap sides. Another reason ladies would be wearing high heels. So if you want to wear high heels, just remember if you wear an inch heel, your body weight shifts forward by about 10 degrees. Then what happens is you're not going to obviously be able to walk like this. So then you start arching your lower back. When you arch your lower back, you start compressing all the joints in the back. So at the back, we have these joints in here. They're called your facet joints. So that would be these joints in here. So they can become painful. Then obviously, if you're arching your back, rather than the joint being nice and level like that, it will tilt backwards. Now, obviously, what's in here? That's a spinal cord. That's your information highway between the brain and the body. So obviously, if you're doing that, the spinal cord is going to get compressed. So that could be another source of irritation and pain. So just bear that in mind. In terms of what footwear would be the best, well, there are a lot of brands out there. I don't want to single out one particular one. Ones I would normally recommend for my patients would be, for example, things like OOFOS, or if you're doing a lot of walking or running, Hoka shoes are very good, or ON trainers. Okay. And then another option, which is something I recommend for all my patients, would be to get these insoles. They cost £40. You take whatever shoe you're wearing, remove the sole of that shoe, and replace them with these. These absorb up to 89% more shock. So I wear them personally in all of my shoes.
Are there any slides? You can't see any pictures. No pictures, no slides, nothing other than one.
I can try and put the link somewhere. Otherwise, I can try and send it maybe to Kamlesh if that helps. But the brand is called Enator, Enertor. They do a running version as well. So for those of you who like running, I would recommend them for your running shoes as well. Now, another source of pain could be the hip joints. Now, going back to the pelvis, when your pelvis is stable and is moving the way that it's supposed to do, then the hip joint, which sits inside the pelvis, it moves around in its socket quite nicely. Unfortunately, what happens when the pelvis tilts or rotates, you're putting unnecessary stress on the hip joint. Now, inside the hip joint, obviously, you've got fluid as a lubricant to help lubricate things. So that can be sometimes get a bit irritated. And then going back to the tilt in the pelvis, if the pelvis tilts forward, sometimes it can be from hip muscles getting tight. So that hip muscle is called the hip flexor or the psoas muscle. So that muscle comes from the sides of these 5 low back vertebrae and attaches on top of the hip. So when it contracts, the hip gets pulled upwards. However, if the pelvis is tilted forward, that hip flexor muscle is constantly being stretched, which again can irritate the hip, which can give back pain, but can also obviously affect the lower back. Then we have all the ligaments around everything. Okay. This is just for reference. This is just an image I put on ChatGPT, so it's not anatomically correct. It's just to give you an understanding of everything. Okay. Another thing is around the spinal cord, you've got the dura. So the dura is basically like the insulation. So in meningitis, that would get irritated and inflamed. Okay. Obviously, meningitis is a serious condition, but we're not going to talk about that. In men, another possible reason for the pelvis to tilt is carrying a wallet in your back pocket. Please never do that because when you sit, you're not going to sit straight. Okay, you're going to put more pressure on the opposite side, so the pelvis is going to tilt like that. Now keep doing these small things over and over and over again. It puts stress on your spine. And how we create stress on the spine is every single day from the day you're born throughout your life, having physical, chemical, and mental stress. So these are all small things that you might not think make a difference, but eventually when pain comes, unless it's traumatic, where you've fallen down the stairs or you had a car accident or something like that, pain is accumulation of physical, chemical, mental stress, big stress, small stress over time. And eventually your brain says enough is enough and it triggers pain, which is a fire alarm. So that is very important. It's your brain telling you, hey, do something about it. When you get pain, sometimes it can be from or be felt in a different reason. So going back to your lower back, like I mentioned, we have 5 joints in your lower back, L5, L4, L3, L2, L1. So in, for example, sciatic pain, sciatica is literally just inflammation of the sciatic nerve. It's not a diagnosis, it's just a symptom. It's a symptom of either irritation on the nerves in here. The sciatic nerve is a big nerve that travels from your lower back. It's about that thick, and it travels through a muscle called your piriformis in your buttock, down the back of your leg. So if the piriformis muscle gets tight, it compresses the nerve and then you get sciatica. So that could be one potential cause. So it's very important to make sure you stretch that muscle. You stretch your hamstrings, which are these muscles at the back of your thighs, because they attach into the bottom part of your pelvis, when your hamstrings are tight, it's going to pull the pelvis down. So it's very important to keep those flexible. Okay. Going back to the sciatic nerve, another potential cause for it would be a disc bulge. A disc bulge would basically look something like that, where the disc bulges out, or it herniates or it protrudes, irritating the nerve. Now, when someone tells me they have back pain and they have pain down the leg, I have to ask them, okay, well, where exactly do you feel it? Because each of these nerves control a different area of skin. The most common disc bulge is between L4 and L5. So that would irritate number 5 nerve. So that controls the area of skin down the back of your leg to your big toe. If it's a L5S1 disc bulge, you would feel pain down the back of the leg to the outside part of your foot, because that's the area of skin that it controls. Then the nerve also controls a muscle. So if there's irritation or compression on the disc or the nerve, you might get weakness in your calf muscle. Or you might eventually develop Achilles tendonitis. So tendonitis is inflammation of your Achilles tendon. So that's the tendon at the back of the heel, because that nerve controls the calf muscle, which then comes down and forms the Achilles tendon. Okay. Every nerve in your body has 3 functions. It's a bit technical, so I'll try and explain as much as I can. So each of these nerves that come from your spine have 3 functions. They have a motor function, which is to control your muscles. So remember, the nerves in your low back control all of the muscles in your legs. No muscle moves without your brain telling it to work. Then it has a function to control your autonomic nervous system. So your autonomic nervous system is the system that regulates your stress response, which is called your sympathetic, or your fight or flight response, and then your rest, growth, repair response. And then finally, it has a sensory function, which is to control not only pain, but also to control touch, temperature, pressure, and joint position. So is my finger up? Is it down? Is it to the left? Is it to the right? Is my head straight, etc. So that's all the information your brain is getting 24/7. Does anyone want to guess the percentage out of 100 for all 3 of these? Any guesses? Okay. This is 45% to control your stress response and how well your body rests, digests, heals, breathes, etc. This is 45%. This is only 10%. So only 10% of your nervous system controls pain. So that's very important to take away. When the spine doesn't move, it interferes with the communication between your brain and your body. So as chiropractors, this is what chiropractors would correct. We analyze it, we assess for it, we take x-rays to check what your spine looks like. And basically that is what it's called. So a subluxation is a vertebra which has lost its normal position in relation to the joint above and below that. So that vertebra can move out of position 10 to 12 different ways. So it can rotate to the left, to the right, backwards, forwards, tilt, etc. So whichever listing that vertebra would be, you can therefore see that it is going to affect the nerve on both sides, as well as the spinal cord, as well as the joint, the ligaments, and all the muscles. So any of those things can create pain. However, the problem is because that joint doesn't move, going back to this, that means that all of these structures do not send adequate information up to the brain. So although we're talking about pain in this talk, that is why it's so important to keep the spine healthy. Because even though you might not feel back pain, when the spine doesn't move properly, it can affect the function of the rest of the body. So the associated symptoms of irritation on the nerves in the lower back might be, for example, sciatica, knee pain, foot pain, digestive issues, period pains, because the nerves control, like I said, the reproductive areas. So chiropractic doesn't treat those conditions. All we do is adjust the spine, free up the pressure of the nerve, and yes, get rid of that, but keep the body healthy. Very simple. When that joint doesn't move properly, after a couple of weeks, we start to get changes in the muscles that surround that joint. So normally you should have nice, healthy muscle fibers that should be able to stretch and relax. And obviously these muscle fibers are very rich in sensory organs. Sensory, which is, like I mentioned, to yes, control pain, but also to control movement and pressure and touch, etc. So over time, when the spine doesn't move properly, these muscle fibers start to get disorientated. And then as part of the healing process and protective mechanism, the body will start splinting or stiffening that level of the spine. So eventually we start to get scar tissue laid down. And scar tissue doesn't move properly, it's very stiff, it's very rigid, and it doesn't send as well those sensory information from the joint to the brain. The other problem that happens then as well, when that joint doesn't move, it starts affecting the health of the disc. So remember earlier I mentioned that your discs are made up of 80% water. So the discs, they rely on natural spinal movement to get blood and nutrients. So when that level of the spine doesn't move properly, it's going to affect the blood supply, nutrient supply into the disc. So that's over time how the disc would start to degenerate. And that ties into what I mentioned earlier, which is that study which I mentioned at the start. So 37% of 20-year-olds having disc degeneration but having no pain. Why didn't they have pain? Because the part of the nerve that was irritated, which is the sensory part, isn't getting triggered. So factors that will affect the health of the disc. Smoking, yes. Drinking a lot of alcohol. Not drinking enough water is also going to affect it, like I mentioned earlier. Not getting enough sleep. Increase in triglycerides and glucose. This is all stress related. Okay. Another factor that you always have to consider is stress. Stress is probably the worst thing that affects every single person on the planet. And again, that ties down to how well your nervous system is regulating between the sympathetic or the stress response and the parasympathetic. So it's very important to manage your stress levels because it is going to affect your spine. How so? When you get stressed, your body releases cortisol, which is the main stress hormone. Stress, although this study says it's from pain-induced stress, cortisol is cortisol, whether it's being released as a result of pain or negative thoughts or negative emotions or whatever it is, you're releasing cortisol, which is going to affect your disc's ability to regenerate. If then on top of that we have all of this, the disc isn't going to be able to heal. And then over time, the disc starts losing its blood supply, so it starts to get dehydrated. And then it further dehydrates and then it starts to degenerate. And because it's getting smaller, the space for the nerve to come out starts getting reduced as well. And then when we get to this phase of spinal degeneration, your body will start laying down bone. So this is called osteoarthritis, which basically, obviously, you already have the scar tissue around this area, here as well. But here, like I said, the spine is literally growing new bone to try and stabilize and fuse that area. Until finally the disc completely is degenerated and you have bone-on-bone fusion. So how to manage stress, like I said, it's up to you. So go for a walk, write in a journal, get all your thoughts down on paper and forget about it, rather than getting stuck in the brain. Speak with people, laugh, activate your vagus nerve. So your vagus nerve is a very important nerve in your body. That's the switch between how quickly and how well your body goes from the stress back to normal. Okay, it's the biggest nerve in your body. It starts in the back of your brain and goes to every single one of your organs. So breathe to stimulate and activate the nerve. Okay, yoga is very good way to keep activating and stimulating the vagus nerve. Okay, any type of exercise, chanting. So things like is a very good way to activate and stimulate the nerve. Smiling. When you smile, you release dopamine, serotonin, endorphins in your brain, and you're going to activate and stimulate the vagus nerve. Okay, so please make sure you manage your stress levels. Because for reference, the hormones of stress, including this, are so effective at shutting down your immune system that stress hormones are given to patients who get organ transplants. Because that patient's body does not then reject the foreign tissue that is then transplanted into their body. So if stress hormones are so effective at shutting down your immune system, how do you think your body is going to be able to heal if you constantly have stress from the time you're waking up till the time you're going to bed? So that's why it's really important to make sure you take a break from your desk, you're breathing to stimulate and calm your vagus nerve, and you're not putting things in your body that's going to create and exacerbate inflammation. When you have pain, you have inflammation. They go hand in hand. If you keep eating sugar, okay, you'll get a massive spike in glucose. Sugar is the most inflammatory thing on the planet. Cut out sugar. If you have back pain, cut out sugar. See how your back feels. I guarantee you, either straight away after a couple of days, it will start feeling better. Okay. Dairy, carbohydrates, etc. Try and eliminate those and see how you feel. Add anti-inflammatory things. So all type of green vegetables, spinach, kale, ginger, garlic, turmeric, cinnamon, curcumin, all fantastic anti-inflammatory things. Okay. If you can go for a walk after you eat something to reduce the glucose spike, because every time you eat or drink something, you get a glucose spike. Now, if you go for a 10-minute walk after eating something, you can reduce that spike because your brain goes, okay, I've got fuel, so let's use that fuel for the muscles because I'm moving. Rather than sitting doing nothing and then you get the glucose spike. So what's it going to do? It's going to make fat and it's going to create inflammation. So if you can go for a walk, like I said, go for a walk. Like I mentioned earlier, when the spine doesn't move, the brain doesn't receive adequate information. When it doesn't receive adequate information, it then affects the output. So it doesn't contract muscles, it doesn't relax muscles, etc. Because 24/7 we get information from the spine, into the spinal cord, back to the brain. Brain is then sending information out into your body. Pain is created in your brain when your brain interprets all of this information and eventually it thinks there's a risk of tissue damage. Pain is only created in your body if your brain perceives there's a risk of tissue damage. If it doesn't perceive there's a risk of tissue damage, it won't trigger pain. If I do that very hard, my brain goes, okay, I'm going to damage my hand, trigger pain. However, if I do that 24/7, it gets used to it. So it switches off those sensory fibers because it doesn't want to be in pain all the time. But the problem is what damage is getting done here? What's happening to the disc? What's happening to the joint? What's happening to the nerves? So don't judge spinal health on the presence or absence of pain, because it's important to make sure that you look after your spine, because a healthy spine is a healthy brain, and a healthy brain is a healthy body. How we create problems, like I said, from the day we're born, throughout your life, every single day, we have three types of stress. Physical, sitting, standing, walking, looking down on your phone, wrong breathing, weak core, etc., etc. Sugar, gluten, dairy, carbohydrates, pesticides in your foods, okay, etc., etc. And then mental emotional stress, eventually leading to back pain. However, like I said, because it's only 10% of your nervous system, these stresses lead to all of these things slowly, slowly. Disc degeneration, disc dehydration, the scar tissue, etc. So keep the spine healthy, do regular exercise, do the things which I will mention in a second, and remove as many of the bad things as you can. Manage your stress. Activate your vagus nerve, breathe, sing, chant, say whatever you want to do, just keep the vagus nerve healthy. Maintain good posture. Like I mentioned, if you look down on your phone at this angle, which unfortunately most people do, especially teenagers, you're putting about 60 pounds of pressure on the back of the neck, which is going to affect the brain, the spinal cord, the muscles, the whole spine. Okay. Avoid sitting for long periods of time. When you sit, you're putting about 300 pounds of force on the disc. The discs, they act as cushions and shock absorbers, and obviously a space for the nerve to come out. So when you sit, the disc gets compressed. And when the disc gets compressed, obviously there is less space for the nerve to move. So everyone has a phone, so keep your phone next to you. Put it on silent if you need to. And take a break from your desk if you can, at least every 15 to 20 minutes. And I'll show you why in a second. Make sure your screen is at eye level. If you're able to, I would always recommend a standing desk because standing puts 200 pounds of pressure on your discs compared to 300 pounds when you're sitting. So if you can, like I said, get either a screen raise or get a standing desk. Okay. Invest in an ergonomic chair. So I have an ergonomic chair. Make sure you have a back support. So either get a towel or a cushion and roll it up and place it in your low back, because that will help to create that natural arch, which you should have in your back, rather than slouching. And when you're slouching, what happens? Well, your spine curve comes backwards, your pelvis is tilted backwards, you're slouching this way, you're compressing your organs. Okay. The best sleeping position is in a fetal position. So that is on your side with your knees bent and a pillow between your knees. Or you can sleep on your back with a pillow underneath your knees. If you sleep with your legs straight and nothing underneath the knees, the spinal cord is stretched. So we don't want our spinal cord stretched. We want a little bit of comfort in it to take some of the slack off it. So by placing the pillow underneath the knees, you're lifting that up and it takes some of the stress and pressure off the spinal cord. In terms of pillows, you should sleep with a contoured pillow. So a pillow that's going to keep your spine straight. This is the same weight as a bowling ball. If you put a bowling ball on a feather pillow, it's going to sink in. When that sinks in, you end up doing that. So all the muscles in your neck are getting contracted, these are getting shortened. It's going to affect your whole spine. So a contoured pillow should keep everything pretty straight. You should have a orthopedic mattress. Not a spring mattress, that's rubbish. I'm not a big fan of memory foam because they don't really give that much support and they retain heat as well. So a orthopedic pocket sprung mattress. Most of the new ones will have either latex or memory foam on top for support and comfort. So that's all fine. You should change your mattress every probably 6 years or so as a general reference. In terms of your bed frame, that's also a very important consideration. So your bed frame, if you have the slatted frames, problem with them is the slatted frames, if it's a double bed, they'll have the slats here and here. So if you have your partner sleeping next to you, his side is going to sink, your side is going to sink. Or her side is going to sink and your side is going to sink. Obviously, you've got the bar in the middle, but the problem is over time, each of your sides are going to sink. So either go to B&Q or to IKEA and get a big MDF board that you can place on top of that because that's not going to move. So then you have the firm base and then obviously put your mattress on top. Like I mentioned in terms of sitting, L45 disc, like I mentioned earlier, is the most common level for a disc to degenerate, and it's most common for disc herniation or disc bulge. So in this study, they put 12 people in an MRI. All of them had a history of back pain. What they found is basically these people were aged from 23 to 66. They got them to sit down for 4 hours nonstop. What they found is if they sat for 4 hours, their L45 disc shrunk by a statistically significant level. However, if those people stood up every 15 minutes, which is what I'm saying, max every 20 minutes or so, if they got them to stand up every 15 minutes, there was no change in disc loss. Okay. So basically, if you sit for 4 hours, your disc is going to start to degenerate. How many of you sit for 4 hours plus a day? See the problem? So for reference, they got them to do 4 exercises once they stood up. So those 4 exercises were standing up, bending forward to try to touch your toes slowly, standing back up, leaning backwards, and then standing straight again, and then bending to the left, and then bending to the right. So standing up every 15 minutes and doing those 4 exercises meant there was no loss of disc height. So for those of you who have desk-based jobs, like I said, get a decent chair, get a low back support, make sure you have everything at eye level. Make sure you invest in something like this for your mouse and for the keyboard, because obviously you want to avoid getting things like carpal tunnel. which is where the nerves in the neck get compressed underneath the ligament in the wrist. Stand up every 15 minutes and do those 4 exercises. We talked about the mattress. When you have pain, something's inflamed. When something's inflamed, it's, like I said, it can be anything. It can be the disc, it can be the nerve, it can be the ligaments, it can be anything. Generally speaking, always use ice. When something's painful, something's inflamed. When something's inflamed, it's hot, it's swollen, it's irritated. You don't put heat on something that is hot and swollen and irritated. It's like you having a fever and going sitting in a sauna. It doesn't make sense. So you want to cool it down. You want to constrict the blood vessels to get more blood into the area and reduce the swelling. 10, 15 minutes, wrap it in a cloth or a towel and leave it on the area. So obviously leave it on your low back because we're talking about the back for now. If it's very painful, you can do ice 10, 15 minutes every hour. But generally speaking, I would normally say something between 3 to 4 times a day. Posture is another very important thing. When I look at back pain, I don't just look at the back because we have to consider a huge amount of other things, even things like your feet. If the feet are flat, it's going to affect the knee, it's going to affect the hip, it's going to affect the pelvis, it's going to affect the back. When the head goes forward, everything gets stretched. So these are all muscle imbalances from round shoulders, forward head posture. So these are all things that we would consider in terms of what would need to be stretched and what would need to be strengthened. These are all your core muscles. So to limit or try to avoid suffering from back pain, it's very important that you strengthen up your core. So these are all the muscles which make up your core. Again, remember, no muscle works without your brain telling it to work. That's why keeping your spine healthy is so important. Your trapezius is this muscle in here. That's one of your big postural muscles, and that's the one which most people have a problem with because most people have forward head posture. Forward head posture is that. So the trapezius is one muscle which needs to be stretched. My experience is probably the most overlooked factor. So your diaphragm is a core muscle and is controlled by 3, 4, 5 nerves in your neck. That's where your breathing comes in. A lot of people are chest breathers. A chest breather is basically just breathing from the chest. So when you look at them, their chest expands. Problem with that is you're reducing your lung capacity, which is how much oxygen you get when you're breathing, which is going to impact the oxygen going into your red blood cells. And your red blood cells carry oxygen-rich blood to every part of your body, but obviously, for now, we'll talk about your muscles. So it's very important to breathe from the diaphragm. So that's where things like yoga and breathing exercises come into the equation. So easy way to do it, put one hand on your chest, put one hand on your belly, just close your eyes and just breathe normally. See which hand lifts up first or the most. So what you want to aim for is to breathe with the belly, because that's where you're engaging your diaphragm. So these are all the muscles that you would need to strengthen for a strong core. Okay. So how you do that, like I said, that's entirely up to you. You can go to the gym, you can do body weight exercises, you can do Pilates, get a personal trainer, etc. But those are the ones in terms of uh, back stability that you need to consider. I mentioned earlier about cross-legged and obviously wearing high heels. So please make sure you wear comfortable shoes and try to limit wearing high heels as much as possible. Lifting, always use your legs. Your quadriceps, which is a thigh muscle in the front, that's the strongest muscle in your body. Okay. So always bend your knee whenever you pick something up. It doesn't matter if it's something heavy or light, always bend your knees. A, because it's a habit you have to get into, and B, it's very important to do. So whenever you pick something up, whenever you do your shoelaces, don't bend forward, always bend your knees. The way I try and explain things in terms of lifting, if I stand up and I bend forward to do my shoelaces and then stand back up, the problem is my brain goes, okay, I'm only doing the shoelaces. So these muscles at the back, they're not getting engaged because my brain goes, okay, forget about the shoelaces. Let's say, okay, I'm picking up a pen. So my brain goes, I'm standing up, bending to pick up the pen. Brain does its calculations, pen weighs, X amount. And then these muscles have to pull up my whole upper body weight, but my brain is only telling it's only picking up a pen. But it's not telling these muscles to engage to pick up whatever your upper body weight weighs. And if you keep bending forward and doing that, eventually you're going to get pain because it's your brain telling you, what the heck are you doing? That's why it's very important whenever you pick something up, doesn't matter if it's something heavy or something light, bend your knees, engage your core. How do you engage your core? Basically, just clench the buttocks, squeeze like you're stopping yourself peeing, and clench and squeeze your abdominal muscles. That's how you engage your core. And then you bring whatever you're picking up close to you and push yourself up with your legs with a straight back. For those of you who might be doing a lot of manual labor over and over, it's probably worthwhile getting a back support or back brace just to help stabilize everything. I mentioned earlier about your diet. Don't put junk into your body because how can you expect to heal from inflammation and pain if you keep adding ultra-processed foods, etc., into your body? And finally, like I said, your spine is extremely important in pain, but also extremely important in your brain health. The world's leading expert on chiropractic is Dr. Heidi Harvick. She's a chiropractor from New Zealand and a neuroscientist. So repeatedly over and over, they are showing that when chiropractors work on your spine, it is changing the part of your brain involved in pain becoming chronic, which is called your prefrontal cortex. Now, that part of your brain is also extremely important because it controls, as you can see, quite a lot of other important functions. So that's where the back problem becomes a brain problem. So when chiropractor is working on your spine, yes, it's for back pain, because obviously that's why you would usually come and see a chiropractor. However, that's why chiropractic literally changes your brain. So a healthy spine equals a healthy brain. And that's why it's so important to look after your spine, not just to wait for pain. Pain is a fire alarm. And it's your brain's interpretation of something going to get damaged. So we don't want to put a patch on it. We want to fix it and we want to look after it. So that's it. Any questions?
That was wonderful. How do I take your screen off? Thank you. Allow. Oops. So, stop, yeah? Okay, I'm back. Any questions from anybody?
Ask a couple of questions. You're ringing in the ear.
Yes, Raman Bhai, please.
Scoliosis cause stenosis. Can scoliosis cause stenosis?
Yes.
And leg change, one leg goes shorter than the other one.
Yes.
And leg movements, you can't get response. When you want to move the leg, it doesn't move. It gets freezes up. It frees up in the same position. Doesn't move. Leg
Sorry,
doesn't move.
I didn't catch that last bit. Can you just
When
repeat
you want to
that?
move the legs, legs doesn't move. It just stays in the same. It doesn't.
Okay, so with a scoliosis usually starts in your lower back. Excuse me. So if you look at your spine, like I said, we've got those five joints. So with a scoliosis, it would usually start in the last two or three joints in your back. So usually L5 or L4 or L3. From my experience, usually it's L5 or L4. So what happens is if we say this is L4, it would tilt, for example, like that. So then all the other joints in your lower back would then obviously curve towards, say, the right side. And then in your upper back to the thoracic spine, that would then compensate and then it would curve to the other side. So the upper back curve would be the secondary curve. The lower back would be the primary curve. So basically, to try and correct or improve upon it or stabilize it would be basically focusing on that. And most likely the pelvis and stretching and strengthening the supporting muscles around that. With scoliosis, it's either congenital, meaning it's something that you were born with. Most commonly, it's more common in girls. So from the age of about 9 to 10, up to about kind of early teenage years, that's when it will start or progress. So you should all, for those of you who have children, get them to stand in front of you and then bend forward and try to touch their toes. If you notice one side of their rib cage is elevated, that usually means their spine is going to be curved, either just curving towards the right or to the left, or as a scoliosis. So it's a test that everyone would do.
Other question is the left heel. The left heel has got pain all the time. When I put my shoes on, it pains. That's why when I take my shoes off, it doesn't pain. I've been to ultrasound scanning. They said there's nothing wrong with the heel. What should I
With
do?
your heel.
Left heel.
Okay. So again, if you have a scoliosis, the nerves in your low back, especially the last one, L5, is going to get irritated. So that, remember, controls your calf muscle. So the heel pain could be from the calf muscle getting irritated and then affecting the Achilles, which is the tendon at the back of the heel. Or it can be from underneath the sole of the foot. There's a tendon, it's called the plantar fascia, so you can get irritation of that sometimes as well.
Dr. Xander, can you please repeat the name of the correct shoes you mentioned earlier?
Yeah, sure.
Enorita. Thank you.
Hi,
Thank you.
I got a question. Can I ask?
Yes, please, Jay,
Hi.
go ahead.
Yeah, I had a spinal decompression surgery about 18 months ago. My pain level has gone down by 90%, not on any painkillers anymore. I'm aged 68 now, but my legs has become very weak. Toes are heavy, not tingling, but feel heavy and weak. And I cannot walk on the toes anymore and got some like balance issues and near falls. Any suggestions?
Yes. Firstly, when was the last time you saw your consultant?
Consultant, I'm seeing the physiotherapists regularly. I just had a new MRI scan just this morning. And
Okay.
yeah, I had chiropractor sessions, but that was before my surgery.
Why did you have the surgery, Jay?
I had spinal stenosis and also disc bulge, but what they did was they removed the bony part of it, but the disc bulge was very minimal, so they didn't touch the disc at all.
Okay. Well, like I said, I can't say too much because obviously I don't know your case and I don't know what your findings especially specifically are. Which levels did you have the surgery at?
That was L4, L5.
So again, yeah, so L4-5 is going to affect obviously your feet. So if you have any surgery there, then yes, there's unfortunately there is a risk of developing things like a foot drop. So that's something you need to look out for and also discuss with your surgeon if worst case that happens. So if a foot drop is basically where you lose control of the foot and you basically can't lift it. So basically you just slap it down. So although it's quite rare, but obviously with back surgery, a lot of things unfortunately can happen. So with the physio, it's very important obviously to stick with that, but have regular obviously checkups and assessments with your consultant and also with the MRI, regular reviews.
Well, question.
Purnabhen, Doctor, can I ask a question?
Yes.
Yeah. Very good session. Doctor, you know, when I stand for a longer time, I get numb feeling on my right thigh. And it's, you know, really painful and tingling.
Okay. How long have you had it?
It comes and goes. It
Do
comes
you get it?
few months and then it goes.
Okay. Do you get it when you're walking?
Yes,
doing-
if it's a long walk, yes, I do that. Do get it.
Does it stop when you rest?
Yes, it does.
Okay. Have you seen anyone for it?
No.
Okay, so possibly it could be stenosis as well. So I would recommend you go and see a specialist, whether it be a chiropractor or a consultant. Just have an MRI because with stenosis you can develop a condition called claudication. So claudication is basically where you get compression on spinal cord and the blood vessels, and there's two types. You get a vascular claudication and you get neurogenic. So if you doing exercise or movement and then you get the numbness or the tingling or the weakness, and then it stops as soon as you rest. Like I said, it could be
Yeah.
claudication as a result of the stenosis. So stenosis would basically be narrowing of the spinal canal that the spinal cord sits in.
Okay.
So like I said, I would recommend you go and see a consultant or at least have an MRI and then see someone just to have an assessment.
Okay. Yeah. Thank you very much.
Thank
You're
you,
welcome.
Ranjanben. Valerie?
Thank you, Purnabhen.
You're welcome. Valerie?
Yeah, hi. I've had problems with my back for many years. And I used to get injection in the spine, and they find that didn't help. Then they taught me, I did 1 month of the pain session, and that was just teaching me how to move around as you spoke about, and how to sit and this and that and the other. But then the other day I had another flare up, and what they did this time was to give me exercise in the warm pool for 6 weeks. Well, it hasn't really helped, because the pain needs to come back to me worse than I was getting the exercise in the pool. So what else can I do? Plus, I broke my ankle some years ago, and they had the pin and a plate in it. I took the plate out 7 years ago. And then today is a year since they had another operation, the ankle, to move pins and a piece of bone. So now when I get the sciatica and the pain, I'm getting spasms in the leg that operated in a year ago. And the back is also going at the same time. What else can I do? Because I think they've done everything they say they can do, but I still suffer.
I would always recommend to see a chiropractor because once that joint in your spine moves out of position, it's going to stay there. You can't stretch it. You can't do an injection for it. You can't take a painkiller for it. You can't ice
Yeah,
it.
but the painkillers don't touch me. I'm on tramadol,
Exactly.
and they don't touch me.
Exactly. So, and all painkillers do is basically just blocks the signals, the sensory signals to the brain, but then essentially you're a victim twice because
Yeah.
you have the problem, but then you have to deal with whatever side effects of the painkiller. Because, like I said, all the medication is doing is blocking the sensory signals to your
Yeah,
brain, making
I
you
agree. I agree.
less aware of it.
Well, the chiropractors around here are very expensive. I'm a pensioner, so I don't have
Where
that sort of money.
where do you live?
I live in Kent.
How close to Ashford are you?
I don't know. I don't know. It's a fair distance away from me.
Okay, because I know someone who works there. Otherwise, the best I can recommend is there's a website that every registered chiropractor has to be registered on. It's called the General Chiropractic Council. So you can go on that website and then just put in your postcode, and they'll give you a list of all the local chiropractors. And then obviously you can just search for
Nearest one.
obviously prices and nearest one and ones which will be the best for you.
Yeah, because it's prices. I mean, I've spoken to a couple before, and they're talking about £60 for half an hour, and I don't have that sort of money right now, you know. So yeah, I'll do that.
Okay, good
Thank
luck.
you.
Thank you. Mr. Ganatra?
Hi there. Yeah, I've got a question for it's for my wife actually. She's just had a lower back. She's just been diagnosed with lower back fractures, and just for our back pain. And is this kind of chiropractor help that area, or is it just a matter of waiting for the fractures to heal over time?
Well, are the fractures traumatic or are they as a result of osteoporosis, and which levels are they and how did it
I
happen? And
I think they
I
may
need a
be
bit more
due.
information.
Yeah, they may be due to osteoporosis, I think. But she was on a she has an autoimmune condition where she was on high doses of steroids, which may have weakened her bones as a result.
Okay.
That's probably explains how she fractured a bone. Now, she fractured it through lifting a small suitcase, which
Okay,
made it worse.
let's go back a bit. So, how long has she had the autoimmune condition, and does she have a leak? Does she have?
Yeah, 5 years. Sorry, yeah, 5 years. Yeah.
Okay, do you have a
Yeah.
leaky gut?
I don't know. Yeah.
Do you know what that is?
No, I don't actually. No. No.
So a leaky gut is basically if you look at your intestines, obviously it's one massive thing. But during a leaky gut, what happens is food particles slowly start seeping into your bloodstream because these tight junctions, they start opening up.
Yeah.
So rather than getting digested, etc., nutrients getting taken up and obviously the rest getting excreted, these food particles
Mm.
leak through those junctions into your bloodstream. And then
Yeah.
your body literally is fighting itself, and that's how it creates an autoimmune condition.
Yeah.
So first of all, I'd recommend that she look into her diet and go and see a nutritionist and
Mm.
have check up for a leaky gut.
Okay.
And then, yes, in terms of the fractures, again, it depends on the severity of them because if it's an osteoporotic fracture,
Mm.
usually it will be a compression fracture. So basically, rather than being a square vertebra, a compression fracture would basically be kind of like that.
Right.
So yes, chiropractic can usually help, but again, it's just on a case-by-case basis. So what we can do is we can work above and below the level.
Mm. And the other question, so will those fractures heal over time, or is it just a matter of waiting, I think, or just
Again,
painkillers?
I can't unfortunately say yes or no because I
Yeah.
don't know her case.
Okay.
Some heal, some don't. But again, how well and how quickly her body, like with everyone, can heal comes down to stress and lifestyle. So
Sure.
what you're feeding your body, what nutrients you're having, your thoughts can heal you as well. If you keep thinking of things that bother you over and over again, it's going to reduce your immune system, getting
I
enough
see.
sleep, etc. So these are all basic things that she should be doing to help herself.
Okay.
But first of all, I would always recommend, just because of the autoimmune condition, consider the leaky gut.
The leaky guts, yeah. Okay. So the other question I've got is, you mentioned not using hot water or something on your back to relieve pain, or using cold ice or something like that. Does that mean she shouldn't use something hot on her back
If
to
she's in
relieve it?
pain,
Yeah.
you use ice.
Yeah.
But you can use, you can also sometimes do contrast therapy, which is doing ice and heat together.
Mm-hmm.
So basically, for example, you could do something like 5 minutes ice, 5-10 minutes heat, and then 5 minutes ice again.
Okay.
Hot and cold. Yeah.
Again, with the heat, obviously heat is more for muscle tension and to reduce muscle tension.
Right. So it may not work for fractures, or I suppose it's just a matter of trial and error, isn't it? I think, yeah, maybe.
Again, if she's having pain as a result of the fractures, I would suggest the ice pack.
The ice pack.
Yes.
Yeah. Okay. The other question is, we
Thank
missed
you.
the early parts of your recording. So is this available as a so I can view it again from the beginning?
All his recordings are on our Zoom link.
Okay, right, yeah.
In our group. So if you want to join in the group, please ring me and I'll add you in there.
Sure.
Okay.
I think my wife's probably on it anyway.
Okay.
Yeah.
Thank you.
Thank you.
There's
Thank you.
somebody IR.
Hi, hello, Panaben. Krishna. Hello, thank you. It's a lovely session. Wonderful. A lot of questions being answered. I have one main question. I mean, I have got multiple conditions and a lot of different pains in my body. And one of the major pain I have is injections. Every injections I take, I get a pain in that area. And they're not clearing. Like when we had COVID, I took 4 injections on my thighs, and that thigh area is just not healing, or whatever. It's just not. The pain is there. It just comes and goes. But I have a lot of pain like that. How can I avoid that or clear that? Any medications would help?
I'm not qualified to advise on any medication. No chiropractor is, because we don't have the training for it. So obviously that's something you have to speak with your GP or a pharmacist about. If you say you have pain in multiple areas, obviously, like I said, I can't give advice because unfortunately I don't know your case.
Yeah,
But
I mean, paracetamol does not help. I do
usually-
take paracetamol when I'm in immense pain, but generally, like that is just not healing that pain area.
Okay. Unfortunately, I don't know. So I won't be able to comment, unfortunately.
Okay, that was a really good advice on the lower back as well. I mean, I had lower back injections few years back. So recently I've come up with the back pain. Should I go for another lower back injection, or should I go for any other therapy or treatment?
With the injection, the injection is similar in principle to the painkiller. So just because the pain is gone, it doesn't mean whatever was causing the pain in the first place, it's gone.
Okay.
So again, it could be the pain could have been as a result of a disc bulge. It could be from degenerative changes in the disc, osteoarthritis. It could be any type of things. So the injection itself, although it might have cured the pain, it possibly didn't fix the actual problem. So I would recommend you go and see someone and either have an X-ray or have an MRI to see what things look like again.
Okay. Lovely. Thank you very
Thank
much.
you, Ilaben.
Thank you.
Thank you. Gitaji, do you have a question?
Panaben,
Yes.
going back to my, thigh problem, I just mentioned it earlier. Is there any other way, I can, is there something, I can do to prevent it, or why it's happening?
Have you tried massage?
No, no.
Okay, well, that's maybe something to consider.
And what is the reason for it?
Possibly whenever, or sometimes when people get injections, you can get some scar tissue developing around the area that the injection was done. And then the soft tissues would contract, and then that can cause sometimes some pain. So when you have a massage, obviously that will help to break up any knots or tension in it. Otherwise, another option is maybe to try to put some cream or lotion on the area. So magnesium lotion is very good because magnesium is very important for normal, healthy muscle function. So you can get some magnesium lotion from Holland and Barrett or from Amazon. It's not that expensive. It's about £7-8.
Okay, Gitaji, there is a question from her. She would like to raise a question. Gitaji, are you there?
Yes, please.
Go
yes.
on.
Yes. I wanted to ask, what is the best walking shoes with a soft cushioning? You would recommend anything?
Well, like I said, I do recommend the orthotics for any type of shoe that you're wearing. In terms of which brands, so like I said, the Hoka, they are quite good.
Uh-huh.
Or Skechers, or On, O-N.
On.
Yes.
O-W-A?
No, O-N.
O-N. Okay. Hoka, on, and Skechers with a soft cushioning, yeah?
Yes.
Okay. Thank you so much. Thank you.
You're welcome.
Okay. Thank you. There is a question in the chat. He wants to ask you about hip bursitis.
Yeah.
What is it and what can be done?
Okay, let me see if I can share my screen again. So if we go back to this slide, can everyone see it?
Yes.
Okay, so a bursa is a fluid-filled sac, basically, that we get around joints that helps to lubricate and helps with movement. So hip bursa is usually located here. So this would be the outside part of the hip. So hip bursitis would basically be inflammation of that sac. So it can limit the hip movement. Obviously, it can affect all the muscles around it. Because obviously you've got muscles attaching into the hip area. So if there's that bursa, which is obviously swollen and inflamed, then it's going to affect basically how well those muscles contract and relax. So again, ice is always something that you need to consider because bursitis, anything that ends in itis, is inflammation. So whether that be bursitis, epicondylitis, which is inflammation of the elbow joint, etc. So anything ending in itis is inflammation based because that's what itis means. So like I said, just put the ice pack on this basically outside part of the hip, and it should help reduce some of the swelling in the area, and obviously try to work on stretching gently some of the muscles around the area. So for example, the hamstring muscle, your glutes, so the muscles in the buttock, and then your muscle in here is called the TFL. So that muscle attaches about here, and it runs down and attaches into the side of the knee. So the side of the knee, that part is called your IT band. So it's very important to stretch that, and also your hip flexor, which is a muscle we mentioned earlier. So how you stretch that is basically just doing a lunge. So basically you stand and just put one leg in front of you and the other leg back, and then just lean slightly forward, or lie on your back with one leg off the side of the bed, and then let gravity do the rest. And then with the other leg, bring the knee to the chest whilst your leg is off the other leg is off the side of the bed. So that's a good stretch for the hip flexor. If worst case, it gets bigger or it's more painful, then sometimes medically they will do an aspiration, which is where they will put a needle into the area, usually through ultrasound, and then just draw the liquid out.
Is that called osmopatch? What is osmopatch?
I don't know.
I don't know as well. Anyway, like everybody's saying, it's a wonderful session we've had, and everybody is asking for your slides. Would you mind sharing your slides with me, and then I can share it in the group, please?
Yeah, I'll try. How do I do that?
No, just email it to Kamlesh, and then he'll share it with me.
Okay.
Yeah. Okay, so what is the most common cause of back pain you see in your clinic?
It's usually
This might
mechanical.
help people relate immediately.
Again, it's very difficult because when people come and see me, I do a full consultation because although back pain is what most people come and see a chiropractor for, there could be so many different types of variations of what's causing the pain. A lot of time when people come and see me, it's because they have a disc bulge. So obviously working on getting the spine functioning better to help, first of all, get the pressure off the disc and the nerve, and then go through stretches and then starting to strengthen and stabilize things and then to maintain it. But usually, like I said, from all the patients I get in, it's usually because they have a disc bulge.
Okay. So,
And most people would have a disc bulge.
okay. Okay. So, when should someone with back pain see a professional instead of treating it at home? Because, some of them normally treat it themselves at home. And is it worth it? Or should they go to the GP and then be referred to a chiropractor?
Well, first of all, GP isn't going to throw you to a chiropractor because all chiropractors are private. There's no chiropractors from what I'm aware of who work on the NHS. So usually the NHS route would be going to the GP, possibly obviously getting prescribed painkillers, but most of the time they would refer to physiotherapy.
Okay.
So in terms of trying to self-manage, well, first of all, obviously you need to check if you're getting any neurological symptoms.
Yeah.
So that whether that be any type of sciatic pain or pins and needles or numbness or tingling, because that's usually a serious issue. So I would always recommend definitely to seek medical attention for that. And then, like I said, worst case scenario, which is 1 in 1 million, if they lose bowel or bladder function because of a lot of times because of a disc bulge, then call 999. Otherwise, trying to self-manage, yeah, you should always do that, be proactive rather than reactive. But being proactive, obviously making all the changes which you mentioned, changing the mattress, flipping the mattress every now and then, staying hydrated, putting the right nutrients into your body. And then if and when you do get pain, obviously, first of all, just do an ice pack. But pain is a warning sign. So I would always recommend, yes, try to do some self-management, but always seek professional advice as soon as possible. Because pain is there for a reason. It's your friend. You shouldn't try and kill it.
I know. Yeah. So is it like, I know you did mention walking, one should do walking daily. Are there any 2 or 3 simple exercises that everyone should be doing daily for a healthy back?
Well, that's a very good question.
Beside walking,
That's fine. So first exercise is called the Williams flexion exercise. So it's very simple, just lying on your back and bring both of your knees up to your chest.
To the chest, yeah.
Yeah. So that will get some pressure off the disc and open up the joint spaces in your back. Second one would be a cobra exercise.
Yeah.
So that would be basically lying on your stomach and then just doing slowly, just arching your back. Because again, if there's a disc bulge and the bulge is coming backwards, that would slowly force it back. Obviously, doing those 4 exercises I mentioned earlier, from the standing up from your desk every 15 minutes, touching your toes, bending backwards, bending to the left, and bending to the right. And then, although it's not linked, well, it is linked to your back, but rolling your shoulders to keep your upper body loose, because if this is stiff and you've got round shoulders and head is forward, it is going to affect your back. So rolling the shoulders forward and backwards throughout the day, making sure your head is level with your ear and you don't have that forward head posture, because it's going to pull the spinal cord and it's going to pull all the muscles that run next to your spine, remember? So keeping that head backwards.
Yeah.
So those would be the main ones I would recommend.
Very good. So what warning signs in back pain should people never ignore?
Losing bowel and bladder function and getting numbness around the back passage, and then down the buttocks and down the back of the thighs. So that's a medical emergency. Or developing any type of, like I said, any significant neurological symptoms, like developing that foot drop, which I mentioned earlier. So basically where you can't control your foot and you basically just slap it down. So those would be the worst case scenarios that, yes, you would have to call urgent care for.
So if one has lost their coccyx, would that affect the back as well?
Well, how do you lose the coccyx?
Well, due to accident or anything like that, because somebody does suffer, and it's a really bad back pain.
I don't think you can lose the coccyx. It can be dislocated. Yes. There are people, I don't know them personally, but where you can do an adjustment on the coccyx. Now, unfortunately, it is an internal procedure where the person will basically have to obviously wear a glove and then basically work on just gently trying to pull the coccyx back. So yes, that can be done. Who performs that? I'm sure certain medical professionals would be able to do it. If you want to go down that route, that's obviously up to the person, because like I said, it is quite a personal procedure. But sometimes people do find relief from it. Otherwise, there are certain pillows that you can sit on that
with
have
the
a hole in the
hole
middle.
in the middle. Yeah.
Yes.
Donut pillow.
Yes. So when you're sitting, obviously you're not putting pressure on the coccyx itself.
Yeah. Okay, so my last question for the people. If you could give us 3 simple tips for maintaining a healthy back, what would they be? Exercise, mainly.
Well, general or exercise related?
General, I would say first.
Stay hydrated. Because like I said, when you get dehydrated, your discs will start to dehydrate. Same thing with stress. Manage your stress. When you stress, you release cortisol, and that's going to affect your body's ability to heal. And like I said, it is going to influence the disc's ability to heal and to regenerate. And stay active. So when you stay active, you're stimulating your circulatory system, which is going to impact, obviously, the nutrients getting pumped into the discs. The muscles aren't stiffening up too much. And like I said, if you do have a desk-based job, make sure that you're standing up regularly.
Thank you very much, Dr.
Can I
Xander.
ask a question?
One last quick one, yeah? Go on.
Okay. When I'm standing for a long time, say about 40 minutes or so in one place, I really get a back pain. What could be the cause of it, or how can I avoid it?
Does it depend on what footwear you're wearing?
Okay.
Yes.
Try wearing flats.
Yeah, flat slipper, especially in the house when I'm doing cooking or so, and for a long time, that happens or so.
Okay, well, maybe try, there's a couple of slippers or sandals you can maybe try. One is from a company called UFOS. So
Infest.
UFOS, OOFOS,
Okay.
or Birkenstock, because they have a bit of an insole and they're quite comfortable as well.
Okay.
So you can maybe try those two. Personally, I always recommend for everyone to try and walk barefoot as much as possible, because your feet are very rich in sensory organs sending information to your brain. And if you keep wearing footwear and you don't go barefoot, it does affect brain function. So when possible, when obviously when you can, if you've got a garden, and when we eventually get some sunlight, try and go on the grass as much as you can. And obviously
Best
indoors,
remedy.
try to work barefoot as much as you can, just to stimulate the information from the feet to the brain.
Okay.
Yes, that's the best remedy, to walk on the grass in the summertime, barefoot. Yeah. Okay.
Thank you very much.
Thank you, Kantaji. Now, no more questions because it is late. We've taken more of your, over 45 minutes of your time. So thank you very much, Dr. Xander, for such an informative and practical presentation this evening. And I'm sure everyone has found the session extremely helpful and learned useful tips from understanding back pain and how to take better care of our spine in everyday life. So remember walking. So on behalf of GAA London, I would like to express our sincere thank you and appreciation to you, Dr. Xander, for giving your time and sharing your valuable knowledge with our community. I would also like to thank all the participants for joining us today and for your excellent questions and interest. Your participations makes this community healthy sessions meaningful and successful. So we hope you find the webinar useful and that you will be able to apply some of these practical tips in your daily lives to maintain a healthy back. So please do look out for future GAA London community webinars and do continue to share these sessions with your friends and family. Thank you once again and everyone for joining us this evening. Have a pleasant evening and stay healthy. Thank you,
Thank you,
Dr.
everyone.
Xander. And we will see him soon again, not forgetting with, I think, vitamin D. Thank you again, and Shubharatri to everybody. Take care.
Thank you. Bye.
Thank
Thank you so much,
Bye.
Panaji.
Bye.
Thank you.
Bye
Good night.
Bye.
Good
Good
night.
night. Good night, Dr. Xander. Thank you all.
Thank you. Bye-bye.
Bye.